Welcome to The Explainer. Today, we're diving into a new paper from the New England Journal of Medicine that could completely change how we think about a super common condition. It basically argues that for a whole lot of people, the way we treat things like varicose veins is, well, just all wrong. Let's get into it. You know, most of us see varicose veins and we think, oh, that's just a cosmetic issue. But what if they're actually a sign of something much, much deeper? We're talking about something called chronic venous insufficiency, or CVI. And we're going to break it down through this really groundbreaking paper from vascular specialists, Doctors Fukaya and Raghu Kolluri. Okay, so the very first thing we have to get our heads around is that this condition goes way beyond just how your legs look. CVI can seriously get in the way of a person's life and can even raise the risk of developing dangerous blood clots. And these kinds of misunderstandings lead to a huge problem in healthcare. The care people get is just all over the map. Some folks are completely undertreated. Their symptoms get dismissed. And then on the flip side, you have other people getting these big, unnecessary procedures that don't even fix the root of the problem. So to help clear all this up, the authors of the paper zero in on 4 major myths that really get in the way of effective treatment. Let's just break them down one by one. All right, myth number 1. CVI is just about venous reflux. That's the thing they see on an ultrasound where blood is flowing backward through a leaky valve. But the paper argues the real culprit is much bigger. The true problem is venous hypertension. That's high pressure across the whole system. And you can have that even if you don't have any reflex. And that leads directly to myth number 2, that a procedure is always the answer. But think about it. If the high pressure isn't caused by a structural problem, like a broken valve, then a procedure to fix that valve, it's just not going to work. You've got to treat the right cause. Now, this one's huge. It's the myth that CVI is something you can just ignore, that it's all about looks. The reality is, so many patients have real symptoms. We're talking pain, swelling, skin changes that can actually stop them from living their lives fully. They absolutely deserve serious medical attention. And the last myth is that the treatment is simple. You just throw on some compression stockings. But that really ignores the bigger picture. The reality is you need a holistic approach because other things, like obesity or even heart conditions, could be the actual source of the pressure problem. So let's pivot to the core concept that's meant to replace all of these myths. It's called venous hypertension. And honestly, this is the key to really getting what CVI is all about. The best way to think about this is to picture your veins like a plumbing system. CVI isn't just one leaky pipe. It's a system-wide pressure problem, and that pressure can build up for a few different reasons. The cause can be structural, so things like that venous reflux we mentioned, or an obstruction, which is like a physical blockage in the pipe. But, and this is really important, it can also be functional. This is all about how the body is working or not working. Things like a weak calf muscle, obesity, or even right heart failure can be the culprit. And here is exactly why that distinction is so critical. The authors use a perfect example. Doing a procedure to close off a problem vein for someone whose leg swelling is actually caused by untreated heart failure, well, it's just not going to do anything. You have to identify the correct cause for the treatment to work. So if we're not just treating a result on an ultrasound, what should the focus be? The answer is so simple, but it's also revolutionary: the patient themselves. This single question, which the authors recommend, completely reframes the entire goal of treatment. It shifts the focus away from just fixing a scan and moves it toward achieving what the patient actually wants, whether that's healing an ulcer, getting pain under control, or just feeling better day to day. So this 3-step process is how you put that idea into practice. First, you understand the patient's goals. You just start by asking what they want. Second, you do the detective work to find the true cause of their high pressure. And only then, third, do you build a holistic plan that addresses the whole person. So why does this shift in thinking matter so much? It really comes down to creating better outcomes for millions of patients, just by improving the standard of care. And it is really hard to overstate how important this paper is. It's the first major update on this topic in a top-tier medical journal in 15 years. That's a huge leap forward in how we understand this disease. Ultimately, the goal here is to get this new patient-centered model into the hands of all doctors who see these patients, from your family doctor all the way to the vascular specialists. Because better awareness means you get better diagnosis, better management, and just better outcomes for everybody. So the key takeaway, the question you can ask about your own care is this. Is the focus on an ultrasound report, or is it on you? According to this new research, making sure the plan addresses the true underlying cause of your symptoms and your personal goals is really the only path to truly effective care.